At the top of the program, you heard the president use one of his new coronavirus briefings to stray from the written script and return to what is apparently a deep-seated belief about children and the coronavirus. He also said he would be, quote, comfortable with sending his son Barron back to the classroom. But according to the New York Times, the school that Barron attends is still deciding whether to open for in-person instruction at all. So it's far less gung-ho in this respect than the president, or his education secretary, Betsy DeVos, who recently said this about the role children play in the pandemic.
More and more studies show that kids are actually stoppers of the disease, and they don't get it and transmit it themselves. So we should be in a posture of the default should be getting back to school, kids in person, in the classroom.
Stoppers of the disease. Again, that is from the Secretary of Education, and no, there's no evidence, zero, to support what you just heard her say. Joining us now is Arnie Duncan, who had Secretary DeVos' job in the Obama administration, also emergency room physician, med school professor, and former Baltimore Health Commissioner, Dr. Leanna Wen. Secretary Duncan, first to you. When you hear Secretary DeVos, with the authority of your former office, say things like that, what goes through your mind?
Well, it's unbelievably disturbing and infuriating. Obviously, she's lying. Obviously, there's no science there. And not only is she fundamentally dishonest, she's dangerous. And fortunately, parents, teachers, superintendents, children aren't paying any attention to what she's saying. She's made herself irrelevant. The president's made himself irrelevant. We're going to be led out of this by amazing local leadership who live in communities, who live around real people, are going to make the right decisions for children, educationally, yes, but also for their health and safety. That's going to happen at the local level, at the grassroots level.
So, Dr. Wen, Secretary DeVos, President Trump, they don't seem to be living in the same universe as Dr. Birx, who we heard earlier, and Dr. Fauci, who echoed the same sentiments today about how little we actually know about how this virus affects children. So how much does this add to the confusion for parents, not to mention administrators, over schools?
I think everyone is struggling with these questions, and at the end of the day, we need to be humble. And I would have loved for President Trump and Secretary DeVos to be honest about, here are the things that we know, and here's what we don't know. We do know that children tend to get much less severely ill than adults do, although remembering that children don't live in a bubble, that is, we're also talking about their parents and grandparents and teachers and staff and their families too. We also, though, do have unclear research about the information about the transmission of virus by children. And there was this South Korea study that was done that found that children under the age of 10 are maybe about half as likely to transmit the virus as adults. But half of a lot is a lot. And the single most important thing we can still need to focus on is reducing that level of virus in the community, which is something that Dr. Fauci and Dr. Birx focus on, but that we have not heard nearly as much from the president.
So, Secretary Duncan, the new CDC guidelines came out last night, and they're really a shell of the previous guidelines, the ones the president said were too tough. So, these guidelines, are they more political or medical at this point?
Well, they're trying to have it both ways. So they're bending to the pressure, the political pressure that they're feeling from him. But if you actually read into it, they say in the fine print that, where you're having an increase in cases, those decisions should be made at the local level. And again, let's just look at the numbers. If you go back to like March 23rd, March 24th, when schools were shutting down, we had about 10,000 cases a day. A month ago, June 23rd, we had 35,000 cases a day. Today, we're having 70,000 cases a day. A month ago, we had 11, 12 states with declining numbers. Today, we only have a single state with declining numbers. So as a country, we're going the wrong way. And it's just infuriating. Had we done what we needed to do in March and April and May and June, we wouldn't be talking about, can we open schools? This was a natural disaster, became a man-made catastrophe. Had we locked things down, had we socially distanced, had we wore masks, had we had a White House that led, had a national plan, we wouldn't be jeopardizing our children's chance to go back to school in the next couple of weeks.
So, Dr. Wen, you hear Secretary Duncan say that local leaders are going to have to step up and make the right decisions, responsible decisions. Would they be better off just using the leaked internal CDC document that was obtained by the New York Times a couple of weeks ago that had on its very first page a warning that fully reopening schools remain one of the highest risks for the spread of the virus?
I compared that document, John, to the document that was released today about the guidance, and they are night and day difference. The document today was basically a justification of why in-person schooling is important, which I think we can all agree that it's important. We got it. But what we need is the guidance on how to do so safely. And actually that leaked document provided that guidance. They actually looked at many different examples of school protocols from around the country and critiqued them and highlighted some innovative best practices. That's what we need the CDC to do. We need the recommendations to be based on science, not have political pressure determine their content. And what local leaders need more than anything is federal resources. They need the resources now in order to do the right thing for their communities. They need local flexibility, and those resources need to be targeted to the communities that are the most disadvantaged, where there are the most vulnerable students who are facing educational as well as profound health disparities.
They need to know how to do it and have the resources to do it right. Secretary Duncan, it's interesting because the new guidelines do have this back door suggesting if the virus is out of control in your county or district, then maybe you should reconsider reopening. And the CDC director, Robert Redfield, clarified that today. He said communities with a positivity rate higher than 5% perhaps should consider not reopening. Well, that's a lot of places. That's California, it's Texas, it's Arizona, it's Mississippi, it's Florida. It's a lot of places.
Well, nationally, we're at about 8.8%, so we're significantly higher than that. And it just puts, superintendents and principals who are so thoughtful in an unbelievably difficult position. And folks who are trying to open totally physically are now having to go hybrid. Other folks that were in a hybrid mode are now having to go only remote, online, because in far too many communities across the country, the rate of cases, the number of cases are going up every single day. Schools aren't bubbles, they're not islands. The best way we can get kids back into a physical school is to beat down this virus in our local communities. Now, I just want to quickly say the goal here is not to reopen schools. The goal is to stay open. So we need to move thoughtfully, carefully, start with those children most at risk, as Dr. Nguyen talked about, start with our babies, see if that works, and then slowly try and add students if we do the right thing. But we've seen other countries, Israel opened too fast and had to shut everything down. South Africa just opened too fast and had to shut everything down. We do not want to do that here, and we should not be in this situation in the first place.
Look, there are places that can do it. The question is how to help them do it safely, and the confusion just gets in the way.